This is the Liko ceiling lift. One thing about this ceiling lift is that it will be charging wherever it is within these rails in the room. Not to be confused with the Arjo ceiling lift, which will have a docking station that you'll want to make sure to have it on whenever you're not using it. We take our spreader bar and we want to make sure we get it over our patient. And then we have the remote control here. You can use this remote to lower the spreader bar, always making sure to keep a hand on the spreader bar so that you don't hit your patient with it or harm them in any way. We've made sure to adjust the bed to about hip height to avoid bending and straining for ourselves. Next, we're going to start at the top. We want to make sure that we have the same color loop on either side. So let's start with the green one. And then we move on down, continuing to make sure we have the same color. So we have the purple one. We'll do another purple one. And we'll move to the green one. If you find that your patient has a longer torso and they don't quite fit into the sling, we can bend our patient's knees right here, and we want to make sure that their feet are inside of this sling so that they don't slip out. On the last loop, we want to go with the red one. We have our handles here to make sure our patient is within the sling, and we have another one up at the top, and we want to make sure that our patient's head is within the sling comfortably as well. Next, we can go ahead and we can lift our patient. Are you doing okay, sir?
Yes.
We want to pause for just a second and make sure that it's going to support our patient before lifting them all the way. We're now ready to transfer our patient. Before we lower our patient onto the stretcher, we want to make sure that they're lined up so that they're going to be comfortable and not fall off of the stretcher. Something I want to make sure to point out, the ceiling lift will always use a loop type of a sling, not to get confused with the clipped slings that go with the Arjo Opera. Always use something with a loop. Anytime we're using the ceiling lift, we always want to make sure that we're bringing the spreader bar down to the patient so that we're not having to hurt ourselves by stretching and pulling. When we're going to reposition our patient, we can do that on our own even sometimes using the ceiling lift. We want to lower this down, and then we want to start with the first loops towards the head of the patient. You put the first 3 loops onto the spreader bar first, and then you put the next 2 loops onto the other side of the spreader bar. Want to make sure, as always, that we have all of our loops inside of the spreader bar. We want to make sure that on the side opposite of ourselves, so the side we're rolling the patient to, that the bed rails are up because we don't want our patient to fall over. Now we're ready to lift our patient. As they start to turn, you can have them take their opposite hand and hold on to the bed rail. Once you get them over, you want to go ahead and you can place your pillows Then we want to go ahead and lower the spreader bar. And we can make our patient comfortable. Go ahead and come on back to me, sir, a little bit. There you go. We're going to use the ceiling lift to get our patient out of the chair. Want to have the patient bend forward a little. We want to put the sling behind the patient and tuck it in, but not all the way underneath the patient. We can have our patient lean back now. We're going to bring our spreader bar down to the patient. Of course, always keeping our hand on that spreader bar to keep it from knocking into our patient and hurting them. We want to start at the top at the shoulder loops first. We'll both put it in the blue sling, the blue loop, okay? Once again, always making sure you have the same color on both sides. Next, we're going to do the leg straps. With the Liko model such as this, we use the ones with the loops and we cross it over. And then we can both put the white loops together. We can now lift our patient out of the chair. We can now move our patient over to his bed. So the ceiling lift can also be used with the limb sling, and you can use this doing dressing changes or other procedures that you need to have the limb held.